I am performing an arthroscopic surgery of a right knee. To the top of the screen is the femur, to the bottom is the tibia or shin bone. This is a probe, and I'm probing the cartilage that lines the femur or thigh bone. As one can see, the cartilage is somewhat loose and it peels off the bone, which is the yellow or orange tissue that you see underneath. The more we probe, the more the cartilage peels off. Once we're able to define the area of cartilage damage, I bring in a shaver which acts like a vacuum cleaner to clean up the debris. Some of the debris is too large for the shaver, so I have to bring in a grasping device to remove this. We're able to remove this tissue through just 2 small poke holes that are less than 1 centimeter in front of the knee. This prevents loose pieces from floating around in the knee. At this point, we have a very large area of bare bone on the top of the screen. I then need to define the area where the cartilage has a transition from healthy cartilage to damaged cartilage. I use this curette, which has a sharp edge, to help find the transition zones where the cartilage is a little bit more irregular so we can remove that. Once this is defined, I bring in this small pick called a microfracture pick. It's a 2 millimeter sharp probe that has a handle on the outside of the body. I take a mallet and I poke several holes into the bone. The goal is to bury the gold tip of this microfracture pick into the bone. This then allows us to get deep enough into the bone where the bone will then bleed. What we're trying to do is create a bleeding surface in the bone. This bleeding then can form a scab called fibrocartilage. At this point, we can see where we have several of these poke holes. We see there's a little bit of red around the poke holes, which would indicate that we have gotten deep enough. As we turn the water off, we see little drops of blood coming out of the bone, which then allows us to have that bleeding surface, which will then form the scar tissue called fibrocartilage. This is how we perform a microfracture procedure.